Okay guys, what I'm going to do today is I'm going to explain to you, try to explain to you the concept of cardiac output. Now, blood flow and cardiac output, total blood flow and cardiac output are basically the same thing. What cardiac output helps explain is how the cardiovascular system at rest is able to pump out 5,000 cc's per minute. So cardiac output, blood flow, Q, 5,000 cc's per minute. Now, we don't pump out all 5,000 cc's at once. What we do is your heart will beat, right? Your left ventricle will contract a certain number of times, and the number of times the heart beats per minute is called your heart rate, right? And normal heart rate is about 70 beats per minute, right? Now, there's a certain amount of blood in the left ventricle before it contracts. So what has to happen right before systole? You have to end diastole. So diastole is the filling phase of the heart. So if you recall, 75% of the blood goes from the atria into the ventricle simply by changes in pressure. And then the atria, which are made of muscle, they will contract and push that additional 25% of the blood into the ventricle. So in a normal heart, a normal resting heart, the amount of blood in the left ventricle before it contracts is about 110 cc's. That 110 cc's is what's called the end diastolic volume, or the amount of blood in the left ventricle before it contracts. Now, when the left ventricle contracts, it's going to force out through the aortic valve a certain amount of blood with each beat. The amount of blood that's pumped out per beat, right, when the left ventricle contracts, is called your stroke volume. So the stroke volume is the amount of blood pumped with each beat of the heart, right? Stroke volume is the amount of blood pumped out with each beat of your heart, each contraction of the left ventricle. And in an average heart, you pump out about 70 cc's with each beat. So, if we look at what cardiac output is, and cardiac output is abbreviated CO, right? Big C, big O, and that's equal to your heart rate times your stroke volume. So what's your normal cardiac output? Normal cardiac output is 5,000 cc's per minute. Okay? What's your normal? That's cardiac output. What's your normal heart rate? Your heart rate is 70 beats per minute. That's heart rate, the number of times the left ventricle contracts. How much blood is ejected with each beat of the heart? Well, that's 70 cc's per beat. That's your stroke volume. So, on a new slide here, we know that cardiac output equals heart rate times multiplied by your stroke volume. So you have 5,000 cc's per minute is equal to, what's normal heart rate? 70 beats per minute times how much blood is ejected with each beat? Approximately 70 cc's per beat. And according to the lovely factor cancellation method that you learned in chemistry, the beats cancel out and you're left with 4,900 cc's per minute, or approximately 5,000 cc's per minute. That is cardiac output. Now, if cardiac output is heart rate times stroke volume, heart rate, number of times your heart beats, stroke volume, the amount of blood ejected with each beat, when you're exercising, you have to send more oxygenated blood to your arms and legs, right? So what has to happen to your cardiac output? Well, your cardiac output has to go up. So how do you know your heart is working harder? Well, you know because how do you increase cardiac output? Well, there's several ways. You can increase the heart rate and keep the stroke volume the same, or you can keep the heart rate the same and increase your stroke volume, or you can do both, and we do both. So watch. And watch how this works. You're not going to believe this. This is scary. But remember, there's no pressure in the veins, and the largest veins of the body are deep inside muscle. I'm going to get really close to the mic and say that again. The largest veins of the body are deep inside muscle. And when you run, you contract more muscle. So that means you will squish the veins more. So what will happen to venous return to the right side of the heart? It will go up. And in a normal heart, if you add more blood back to it, what do you do to the actin and myosin? You stretch them. And when you stretch them, you put them in better alignment. So what happens to the force of contraction of the right ventricle? It increases. So that increases the amount of blood ejected with each beat, which we learned is the stroke volume, and you increase the force with which that blood is ejected. So the right side of the heart, that systolic blood pressure on the right side of the heart increases. So now you're going to send more blood to the lungs, and we learned, oh, lest we forget, that the amount of blood pumped by the right heart is equal to the amount of blood pumped by the left heart. So now you're going to send more blood back to the left heart. You're going to stretch a left heart, which is normal. It's normal. That's going to line up the actin and myosin better. So the left side of the heart is going to increase the force of contraction. So that's going to increase your stroke volume and increase your systolic blood pressure. Now, is exercise stressful? Yes, it's bad for you, right? Stressful. So when you exercise, that that stimulates the sympathetic nervous system and stimulates the release of epinephrine from the adrenal medulla. And we know what that does to your heart rate. So you get the combination of the increase in heart rate and you get the increased force of contraction because you're adding more blood back to it, so you're stretching it. So this is how we increase our cardiac output when we are exercising. Yay! So let's go back. Let's go back. So that's cardiac output. Now, let's look at some of these volumes, and from a clinical perspective, these are important. We talked about the end diastolic volume. The end diastolic volume is the amount of blood in the left ventricle before it contracts at the end of diastole. So that final relaxation phase, and then what happens right after it relaxes? It's going to contract, right? So you've got a certain amount of blood in that left ventricle. That end diastolic volume, the amount of blood in the ventricle before it contracts. And we said that our end diastolic volume normally is about 110 cc's. Now, how much blood at rest do we eject with a normal left ventricle? We eject about 70 cc's. So our stroke volume is 70 cc's, or the amount of blood ejected with each beat. So there's going to be a certain amount of blood left over. We haven't pumped out all of that blood. And the amount of blood that's left over after the left ventricle contracts, is going to be called your end systolic volume. The end systolic volume is the amount of blood in the left ventricle after it contracts. So what was the amount of blood before it contracted? 110. What was the amount of blood ejected with the contraction? 70 cc's. So the end systolic volume in a normal heart is about 40 cc's. Now, what cardiologists, doctors want to look at is how efficiently, how well is that left ventricle contracting, right? So they will do an echocardiogram. You can actually see blood flowing through the valves and through the ventricles. So they can estimate how well the left ventricle is contracting. So what they look at is what's called an ejection fraction. That looks at the overall functioning of the left ventricle, actually all the valves, but are chambers, but we're more interested in the left ventricle. And how you determine ejection fraction is you take the amount of blood that was ejected with each beat, which is called your stroke volume, and you divide that with this line by the end diastolic volume, or the amount of blood that was in the ventricle before it contracted. So if you take 70 cc's and divide it by 110 cc's, you're going to get a percentage, and that percentage is about 64%. So that is considered a normal ejection fraction. If your ejection fraction is less than 50%, you have congestive heart failure. The lower the ejection fraction, the worse your heart is. You're in trouble. So now let's look at a heart that has congestive heart failure. I just made the video on congestive heart failure, right? It's a failing left ventricle. So if part of your heart is dead because you had a heart attack, the other part of the ventricle, the left ventricle, has to take over. And how does it work harder? It works harder by stretching. So in this case, you have this dilated left ventricle. But because it's dilated and it's damaged, it doesn't contract as well. Even though the other parts of the heart are working as hard as they can, they're aligned as good as they get, right? This left ventricle is still not contracting very hard. It contracts very weakly. So now it gets stretched out so it can hold more blood. So in a person with congestive heart failure, right, in CHF, right, in a normal heart, what was the normal end diastolic volume? The normal end diastolic volume was 110 cc's. Now, a person with congestive heart failure, that ventricle gets stretched out, right? So the amount of blood it can hold increases. So the end diastolic volume in a person with congestive heart failure may go up to 210 cc's, right? So that left ventricle gets enlarged, but remember, the left ventricle, because it's damaged, doesn't contract as hard. So there's more blood in there. But remember, the goal of the cardiovascular system is to maintain Q, maintain blood flow. So they still, even though that heart is contracting weak, they still got to pump out their 70 cc's. So their stroke volume still has to be 70 cc's. So if you look now at the ejection fraction of someone with congestive heart failure, right? Remember that ejection fraction equals stroke volume divided by end diastolic volume. Now remember that in a person with congestive heart failure, that left ventricle is stretched out, it's contracting weaker, but you still got to maintain Q. So if you look, their stroke volume still has to be 70 cc's, but how much blood was in that left ventricle, that damaged left ventricle, before it contracted? 210 cc's. So their ejection fraction now has dropped to about 33%. So this person has severe congestive heart failure. Now, what has happened to the amount of blood left over? Well, do the math. The amount of blood in a person's left ventricle who has congestive heart failure, that has gone up. So their end systolic volume goes up as well, or the amount of blood in the left ventricle after it has contracted, right? So after it contracts, it's going to push out that 70 cc's, so what's left over is the end systolic volume. So again, as the heart weakens, this ejection fraction begins to drop, and that's how physicians can tell if their heart failure is getting worse. Now, let's look at this for a minute. If you've ever worked on a cardiac floor, one of the things that the cardiologist wants first thing in the morning is they want to look at the patient's weight. Why do they want to look at their weight? They want to make sure that that patient can get into that sequence stress for that. Oh no, it stopped working. Hang on, I'll be back. Okay, that's what I get for cracking wise. Anyways, what happens is you want a patient who is on a cardiology floor with the diagnosis of congestive heart failure, or any heart ailment for the most part. You want to monitor their intake and output. No one in the hospital is going to gain 5 pounds eating hospital food. However, you can gain 5 pounds of water if your heart is failing. So that's why they want their weight. And again, it comes back to knowing Starling's law of the heart. So watch. In a normal heart, if you increase venous blood back to the right side of the right side of the heart is going to stretch, right? When you stretch, you line up the actin and myosin better, and the force of contraction is going to increase, so the amount of blood sent to the lungs is going to increase, and the pressure with which that blood is sent is going to increase. And because the right side of the heart and the left side of the heart pump exactly the same amount of blood, you're now going to be sending more blood back to the left side of the heart from the lungs. Now, in a normal heart, you're going to stretch it and it's going to handle it. And that's going to increase your systolic blood pressure and the amount of blood ejected with each beat. And anytime you increase your systolic blood pressure at rest, that's going to increase pressure in the kidneys, right? And that's going to force you to pee more. It's called pressure diuresis. And you pee. That's why strict I&O is a requirement in people who have heart problems, especially in congestive heart failure. So watch. Do you want a lot of blood coming back to the right side of the heart? No. The right side of the heart is fine. It's going to stretch and it's going to send more blood to the lungs. But your left side is jacked up. So if you send more blood back to the left side, that heart will become overstretched. And if you overstretch that left ventricle, it's now going to contract even weaker. So the amount of blood ejected with each beat of the heart is going to go down. So their stroke volume is going to go down. And their systolic blood pressure is going to go down. And when your systolic blood pressure begins to drop, that's going to cause a decrease in urine output. Right? So these people, you have to monitor their intake and output. So if they're drinking 5 bottles of Diet Mountain Dew and they're peeing a thimbleful of urine, that fluid has to be going somewhere. And in the left side of the heart, that fluid's going to back up into the lungs and they're going to get pulmonary edema. So you don't want that. So one of the drugs that all patients with congestive heart failure are on are diuretics. So if you recall, just recall anywhere, right? Blood is about 60% water, right? So if you give a person a drug that makes you pee excessively, more than they should, that is going to make your blood volume go down. And if your blood volume goes down, that's going to decrease venous return to the right side of the heart. And if less blood in the right side of the right side of the heart won't be stretched as much. That means that the right heart is going to contract with less force, and therefore the stroke volume will go down, and their systolic blood pressure to the lungs is going to go down. And because the right side of the heart and left side of the heart pump the same amount of blood, less blood is going to come back to the left side of the heart. Now, in a person with congestive heart failure, like I said before in the CHF video, at rest, their actin and myosin are as good as it gets. So if you send less blood back to the heart, you can actually improve that alignment a little better, right? So that it will actually contract a little better because you're not overstretching that heart, right? So less blood going back to the right heart, less blood in the left, the heart doesn't get overstretched, so it contracts better. So one of the drugs that all patients with congestive heart failure are some form of diuretic. So in a person who comes in where their CHF has gotten worse, the physician's going to diurese them. They're going to give them heavy doses of diuretics to get that excess fluid off them. And when we get to the kidney, I'll explain how that stuff works. But right now, what I want you to understand is why diuretics are given. The other thing that you want to do, right, is you want to increase the force of contraction of the left ventricle. And one of the drugs that does that is called digitalis. And there is a video that I put together for you guys because I like you guys as far as you know. I put together a video called the Mechanism of Action of Digoxin, digitalis, right? And why digoxin is given to patients with congestive heart failure. Now, right, you can look at that. So what do you want to do with a person with congestive heart failure? You don't want to fluid overload with them because it'll overstretch the right side or left side of the heart. You want to improve the contraction of the left ventricle, and that is digoxin. That increases the amount of calcium in the heart muscle, and the most important element of muscular contraction is calcium. So digoxin, and I explain in the video how it increases the amount of calcium in the heart muscle to make it contract harder. Now the other thing is with Ohm's flow law. Now look, and this is important. You have a jacked up left ventricle. So you got your left ventricle right here, and it ain't contracting so good. Okay? So it's got some blood in there. In this case, the blood is yellow, so there's something definitely wrong with this person. No idea, they got yellow blood. Who knows? But watch. If that left ventricle is contracting weakly, right? And is trying to send it blood to the body, oxygenated blood to the body. Do you want those arteries to be this big or this big? Now let's look. According to Ohm's flow law, which we have studied and loved, the goal of the cardiovascular system is to maintain blood flow, right? Systolic blood pressure is determined by the force of contraction of the left ventricle. Well, in someone with CHF, their left ventricle, right, their left ventricle contracts weakly. Not weakly, but not very well. So, do you want that left ventricle to have to pump that blood through arteries that are this big or this big, A or 2? Well, arteries that are small, we learned, increase the resistance to arterial blood flow, and therefore the systolic blood pressure has to go up. Now, in a person with congestive heart failure, the left ventricle is contracting weakly, so it's not going to be able to force that blood through those small arteries, so you're going to be in trouble. So all patients with congestive heart failure are given a drug that will cause the systemic arteries in their body to dilate. So all patients with congestive heart failure are given some form of a vasodilator. And the most common form of a vasodilator to be given are called ACE inhibitors. And when we get to the kidney, I'll explain more about that. But these ACE inhibitors, one of the things that they do is they dilate arteries, and that will decrease the resistance to blood flow, and that decreases the systolic blood pressure, and you're still maintaining Q. So the left ventricle doesn't have to generate as much pressure, right? So when you dilate arteries, you reduce afterload. Afterload is the amount of pressure or the amount of resistance that the left ventricle has to pump against to get that blood out. So in a person with congestive heart failure, you want to dilate those arteries, so you want to decrease the resistance to blood flow and decrease that afterload so that left ventricle doesn't have to generate as much pressure to get the same amount of blood out. Right, so those are the basic medications used to treat congestive heart failure. So let me just sum it up, right? So the medications, number one, are diuretics. Diuretics decrease your blood volume and therefore decreasing venous return and stretch of both the right and left ventricle, and that's what you want. Number two is you want to increase the force of contraction, how hard that left ventricle is contracting. Their problem is that it doesn't contract very well. So what do you want to do? You want to make it contract better. So the drug that will do that is called Ejection. Now, a couple of terms here. Ejection increases the force of contraction. Another big fancy term for increasing the force of contraction is that it is a positive inotropic agent. Inotrope refers to the force of contraction. So digoxin is a positive inotropic agent. You know of another one, darn it, right? Epinephrine increases the force of contraction of the heart. So epinephrine is a positive inotropic agent, right? What's the most important element in muscular contraction? Calcium. So calcium channel blockers, watch it. If less calcium is getting into those actin and myosin filaments, you're not going to be able to make as many connections between actin and myosin. So what's going to happen to the force of contraction? It is going to decrease. So calcium channel blockers, several of them, are what are referred to as negative inotropic agents. So yeah. So diuretics, remember, what's preload? Venous return to the heart. So diuretics decrease preload on the heart. They decrease the stretch of the heart. What do vasodilators do? They decrease the resistance to arterial blood flow. So in CHF, you want to decrease the afterload and decrease the preload on the heart. And those are the medications used to treat CHF. Yay! Yay! Them Duke boys got my money.